I couldn't see very good at all through my right eye. It was very cloudy, smoky-like, and I didn't know where I was going to find a good doctor. My eye was just fantastic. This is one fabulous doctor. I could never say enough about him, truly.
I'd like to welcome Laguna Woods to my office. We help our patients maximize their vision and live their lives to the fullest.
The Orange County Eye Institute is a comprehensive eye care center. See well, live well.
We welcome you back to our program. You know, one of the areas of health that we're all very concerned about from a variety of reasons is our eyesight, keeping our eyes healthy and well. And our next guest is an expert in that field. Dr. George Salib joins us today. Doctor, welcome to the program.
Thank you. Thanks for having me.
Good to have you with us today. So a little bit about your background. Where'd you grow up? How'd you get interested in medicine and ophthalmology?
Right. Well, actually, I grew up mainly in Southern California. I was actually born in Canada, in Montreal, Canada, so I'm a Canadian, but I grew up mainly in Encino and in the South Bay area, in the Palos Verdes area. And I have been, medicine's been in my life almost all my life. My dad is an associate professor of psychiatry at Harbor UCLA, and so I was always kind of interested in medicine. And I'm a local UCLA graduate, so I'm very happy about that. And after that, I went on to do a master's degree at Georgetown University in physiology and biophysics.
Right.
And went to medical school at the University of Wisconsin in Madison, where I studied medicine. And then I went on to do my training in ophthalmology and general surgery. I did a year of general surgery at Hahnemann University at Medical College of Pennsylvania in Philadelphia. And then I came out here to Los Angeles, where I did my ophthalmology training at a very big trauma center here associated with UCLA called the King Drew Medical Center. And that afforded me a really great opportunity to do hands-on surgery and lots of medical checkups. And then I went on to do a fellowship at Tulane University in New Orleans, where I specialized in complex surgical treatments of the eye, including corneal and refractive surgery.
Not only have you had a very interesting medical education, but you've had a chance to travel extensively from Canada to Louisiana, East Coast, West Coast, so you've had a good look across the country. I would imagine because of the differences in weather, the differences in lifestyle, eye conditions and eye problems might be somewhat different in different parts of the country?
Sure, yes, of course. For instance, in Louisiana, it tended to be a little more humid, so we would see things like actually fungal infections sometimes of the eye. Whereas out here in California, it tends to be a little more dry, and I'll see a lot more dry eye disease. And depending on where you go, for instance, in the rural parts of the country, like in Wisconsin, for instance, there were some rural clinics we had to go to. People would leave their eyes to get, like their cataracts, for instance, to get very advanced before they came in for surgery. So yes, it does vary.
Yeah, I would imagine very interesting. But you're back here in California now dealing with the eye conditions here locally. You mentioned dry eye, and I know you've written extensively about that and also done quite a bit of, I guess, testing as well for some of the various products. And we were talking before the program, we see a lot of these things advertised on television, things to make our eyes less dry, things take the red out of our eye. And some of these things are available over the counter. Some of these things are actually prescription items. You were saying that some people maybe can benefit from some of these things. It's not just advertising, basically.
Oh, yeah, sure. And I generally only talk about things I have done extensive research on and believe in. In fact, I actually use one of those products myself, Restasis, which I'm sure a lot of people have seen advertisements on, but it makes a big difference. I've had LASIK in my own eyes, and so my eyes tend to be a little more dry than others, and so I had dry eyes actually before I had the surgery. So I use that product, and I really think it's a very beneficial product.
Right. You mentioned cataracts, and I guess that's something if we all live long enough, I guess we'll all have to deal with that eventually.
Right.
It's just part of the aging process. I've heard in some cases it could be even in some young children with unusual situations, up to people maybe in their maybe in their mid-80s before they have to deal with it. So it doesn't really depend on age. It's more of a physiological situation, I guess.
That's right. Age is the most common reason that people get cataracts. So if we have enough birthdays, we're going to get cataracts. But definitely there are other conditions that can cause cataracts. Some kids are born with cataracts and you have to operate on them even within a couple of days of birth. Some people develop cataracts earlier from diabetes, and other people can develop cataracts if they've had a previous trauma to their eye. So there's lots of different reasons people can get cataracts, but the most common reason, birthdays.
Right. So I guess what this all says is that really what we need to do is get in for regular eye exams. And I guess they say that about every 20 years our eyes go through some changes. So when we hit 20, 21, getting out of college maybe, and again maybe 40, kind of mid-career, and then maybe again at 60, is there another change at 80? Do we see another 20-year change in that at that length of time?
Well, I would say, around the age of 60, people tend to start to get cataracts. Usually around 80 is when people start to notice a significant decrease in their vision.
Right.
Some people notice that decrease in their 60s, but I would say most of the people around here, since they generally take good care of their health, they tend to have decreased vision around the age of 80 for cataracts. And then we have to also worry about other things like macular degeneration. And dry eyes, of course, is a huge problem.
Yeah. I know you've got an extensive background, and you mentioned some of the work you've done previously. You've done a lot of cataract surgery. Not that that's a specialty necessarily, because as an ophthalmologist, you really treat, you mentioned, fungal infections to dry eye to laser surgery. All these various things are all part of the ophthalmologist's bag of tools, I guess, these days.
Right. Yeah, definitely cataract surgery is my biggest forte. And when I was in Los Angeles, before I came out here, I was one of the top cataract surgeons in that city in terms of the numbers and in terms of the quality. But definitely we treat all sorts of diseases. I look at glaucoma. I have one of the biggest records of glaucoma treatment, especially in Los Angeles. I was one of the top prescribers. Dry eye disease, of course, macular degeneration. I'm a corneal trained specialist, so I can do corneal transplants, LASIK. So there's a variety of diseases we look at and also a lot of conditions we look at.
Right. You took over Dr. McCarthy's practice.
Yes.
And are now enjoying working with our folks here in Laguna Woods Village. I would imagine with all the different places that you studied and practiced, again, you've had a wide variety of experiences of affluent communities, not so affluent communities, the South, the West, up in, I don't know if you did any work in Canada or not, but you certainly lived up there for a bit. So you've been all over and seen a variety of things. You mentioned the people here take good care of their eyes. Give us some tips. We all hear about sunglasses. Should we all wear sunglasses in California?
Yes, I would definitely suggest that. The sun can have many different effects on the eyes. It can affect cataracts, it can affect macular degeneration. It can also cause little sunspots to come on your eyes. So wearing sunglasses would be helpful. If you do have uncomfortable eyes or irritated eyes, you might come in for an eye exam so I can see what is the problem. A lot of the time it's just a simple problem like dry eye disease or something where the eyelids can get a little irritated. And of course, drinking plenty of water and fluids is helpful in maintaining good eye health because of the dryness. Sometimes omega-3s can help. So there's a lot of different things you can do.
Good.
But generally, checkups are important.
Where's your office located if people want to come by and see you?
Yeah, at the Saddleback Memorial Medical Tower, at that tower just attached to the hospital. So we're on the 3rd floor in 340.
And I understand if clubs and organizations are looking for an interesting speaker, you'd come and share with them.
Oh yeah, I'd be happy to. I'm really excited about being here, and if anyone wants me to come by and just give a little talk about eye disease or cataracts or anything, I'd be happy to.
Great. We thank you for joining us. Good to have you on the program today. If you want to contact the doctor, there's his number on the screen, 770-1322. And again, nearby offices, and he can give you a good eye exam and also maybe come and speak to your club or organization. Thanks for joining us. Good to have you on the program today.
Thanks a lot.
Appreciate you being with us today.
Thank you.
And we'll be coming back with more things to share with you as we continue on Channel 6 for this Monday.
My vision was getting increasingly poor. I had to use a magnifying glass on more things to read. I came to Dr. Salib, and Dr. Salib said that I did have cataracts, which wasn't a surprise. After the surgery, I was astonished at how much better I could see. It was like brand new vision.
We help our patients maximize their vision and live their lives to the fullest.
We are located in the Saddleback Memorial Medical Towers. See well, live well.